Hello, everyone. We'll get started as we get a little closer to 12:30.
Okay.
We'll give it one more minute.
Yeah, I saw 17 signed in.
All right, if you'd like to go ahead.
Hi, good afternoon. This is Larry Losey. I'm going to be talking today for this webinar about HPV vaccine. Just a brief word of introduction. I'm a pediatrician. I have practiced in the Brunswick, Maine area since 1979 and have 25 plus years experience working on immunization, organization, and funding. I'm a member of the Maine Vaccine Board, which provides immunizations at no charge to the practices or clinics, and we've been very successful with that. So we've got a bunch of stuff we want to cover about HPV and emphasizing the importance of HPV vaccine for the prevention of cancer. As this is a CME granting episode, disclosure, my family and I have no financial disclosures, no stock, no speaking fees, no little doodads from the pharmaceutical companies. So the objectives for our talk this afternoon, talk about why HPV vaccine is important for cancer prevention, review the schedule that is recommended by the US CDC and endorsed by the American Academy of Pediatrics, the American Academy of Family Physicians, and others. We'll talk some about what the vaccine is, how it's made, what it's trying to do, what effect it has had, and talk about ways of talking with parents that have some vaccine hesitancy. So that's what we'll be trying to do, and I hope we can meet that. And I'll try and get through this in enough time that we can have several minutes for Q&A. There is a feature in the webinar that you can send a question in to put in the queue for us to talk about at the end. Okay, so HPV, human papillomavirus, and we'll talk some about that. Important to recognize that HPV is a large family. There are about 120 different types of HPV, but they can be divided into two groups, ones that affect mucosa and ones that affect the skin. We're all acquainted with the skin ones, the good old warts, plantar warts, warts in other places. Those are not oncogenic. They do not cause cancer. But there are 80 types that cause that, about 40 types that affect mucous membranes, and some of them are oncogenic and are associated with later development of cancer from a chronic infection. And the two most common ones that are oncogenic are types 16 and 18. And there's some low risk ones, HPV 6 and 11 are two of them, that are not oncogenic. And the oncogenic ones cause exciting things like cervical cancer, anogenital cancers, oropharyngeal cancer, precancerous lesions, and low-grade cervical disease. The low-risk mucosal vaccines, 6 and 11 are the most common ones, genital warts, laryngeal papillomas, small nodules on the vocal cord that we sometimes see in children that get infected during birth, and low-grade cervical disease. most males and females will be infected at least one type of mucosal HPV at some point in their lives. It's estimated that there are 79 million Americans currently infected, and there are 14 million new infections each year in the US, and HPV infection is most common in people in their teens and their early 20s, and most people will never know that they have been infected. Might find out because of an abnormal Pap test or a diagnosis of genital warts. Things like that can say, oh, that HPV is there and is causing you some issues. We're most concerned about cancer. I mean, we'll talk a little bit about genital warts. They're gross, disgusting, icky, and hard to get rid of, but it's more of a cosmetic problem than a threat to your life and health. Cancer of the cervix, obviously it's only women. 91% of the almost 12,000 cases a year in the US are from an oncogenic strain. Cancer of the vagina, 75% are from an oncogenic, are caused by an HPV type. And then cancer of the vulva, cancer of the penis. Cancer of the anus is interesting because 91% of the cases of cancer of the anus are with HPVs. And, and I find it fascinating that it's almost the same number of oropharyngeal cancers occur in men as cervical cancers occur in women, and about 5 times more frequent for men to get oropharyngeal cancers, 70% of which are caused by the oncogenic strains. Looking at just the total number of cases and a breakdown of the HPV types, you'll notice cancer of the cervix, 7,900 cases a year are caused by HPV type 16 and 18, and then another 1,700 are caused by the 5 types of HPV that are also in the HPV vaccines that we use. 1,200 of those cases are caused by other types of HPV. And similar kinds of scale, although cancer of the oropharynx is even more predominantly HPV type 16 and 18. This is looking at ethnic and gender background for what are the rates for getting this. And you'll note that for 4 ethnic groups, whites, blacks, non-Hispanic, and Hispanic whites, very, very similar rates. And overall, women have significantly more cancers that are attributable to HPV than men. I had a whole bunch of additional slides in here with the similar breakdown for different types of cancer. I hid them, so we won't be going over those. Cervical cancer is the most common HPV-associated cancer in women. 528,000 new cases, 266,000 deaths worldwide in 2012. In the US, about 12,800 new cases and 4,000 deaths. That was numbers from 2015. You will note that deaths per 100,000 women in the US have gone down quite nicely, well over 50% reduction from 1975 to 2015. We can, we should be, and we will do better. Important to recognize that half of the cervical cancers are in women that are under 50 years of age, and a quarter of the cervical cancers occur in women 25 to 39 years of age. So it does affect younger women than we usually see with cancers occurring. Precancerous lesions are very common in women. There are about 300,000 high-grade, meaning looking like they have a significant potential to become cancer, lesions every year for women. The illustration on this slide shows what is done for a precancerous lesion. It's doing surgery on the cervix to remove the part of the cervix where the infection occurs. So, that's about cancer of the cervix that we see, that is 91% related to the HPV types. So one of the biggest points to make today is to get the word out. We're giving HPV vaccine to prevent cancer. It's really the first vaccine that is overwhelmingly targeted to reduce cancer. Hepatitis B vaccine reduces hepatobiliary cancer, but that's more of a secondary effect. HPV primary effect is to prevent cancer. Now, it's an interesting vaccine because they use recombinant yeast, that is, yeast into which DNA has been inserted to make a shell that looks like the outside of the human papillomavirus of the various types. They call them virus-like particles. They're not infectious. They don't have the machinery inside. They're just globs, but the immune system learns to recognize those globs and produce antibodies against them. And it's interesting that you get higher antibody levels from having the vaccine than you do from having an infection. Now, there have been 3 approved vaccines for HPV. However, only one is currently being marketed in the US. The Cervarix vaccine contained only 2 types. It was bivalent, and it was 16 and 18, which were the bad actors for causing cancer. The first generation of Gardasil only had 4 types in it. It had the 16 and 18, the bad actors, and then it also had types 6 and 11, which are the types that cause genital warts. So you got oncogenic protection, genital wart protection from it. A few years ago, they added 5 more oncogenic strains, and they at the bottom it shows how 63% of the cancers in body parts where they find HPV DNA, 63% are from the 16 and 18, and 10% more are caused by the other 5 types. So it broadened the protection against additional types, though they're less common than the 16 and 18 bad actors. So recommendations for HPV vaccine, the CDC, the American Academy of Pediatrics, the American Academy of Family Physicians all endorse giving HPV vaccine to children of both genders starting at 11 to 12 years of age. It can be given as young as 9 years of age. A few years ago, they found that 2 doses was ample if you start before 15 years of age. The first dose followed 6 to 12 months later by the second dose. There is some research just coming out that it may even be adequate to have 1. I certainly could not recommend it because there are not adequate studies and long-term follow-up on that. But it is a very highly effective vaccine, and children in the preteen, early teen years actually have a stronger antibody response, get higher antibody levels than when they get the vaccine before they're 15 years of age. Now, there were changes in the recommendations from the Advisory Committee on Immunization Practices at their June meeting, and I left in green the old recommendations. The black are the current recommendations. It's recommended that catch-up vaccine be given to all persons, either gender, through the age of 26. No longer is it saying that persons at high risk, gay, bisexual, other men who have sex with men, transgender people, people with immune compromised, should be given that vaccine up to the age of 26. Everybody up till the age of 26, it's recommended that the vaccine be given. So that eliminates the gender and risk differences. It's universally recommended up until 26. They also added a permissive, if desired, if indicated, if requested, can be given to men or women up to 45 years of age if they've not been previously immunized. And that is a new recommendation. However, it puts the ACIP's recommendations in line with the FDA's approval for administering HPV vaccine up to 45 years of age. And, when would you consider immunizing an, well, from my standpoint, it's an older person. Anybody over 26 is way outside of what I deal with. And, one scenario, a woman that has been married, has gotten divorced, has only had one sexual partner, has had negative pap smears or HPV screens, and she's now thinking of starting to date and perhaps forming relationships with other men or women, she would certainly be a candidate up to 45 years of age to give the HPV vaccine to. Now the schedules, again, if you start the vaccine series before the 15th birthday, 2 doses, 6 to 12 months apart. There is a little elasticity. Minimum interval between dose 1 and dose 2 in the 2-dose schedule is 5 months. If you start on or after the 15th birthday, 3 doses of HPV vaccine. Second dose, 1 to 2 months after the first, and the third should be administered 6 months after the first dose. Minimal interval between dose 1 and dose 3 in that 3-dose schedule is 5 months. So if they get it a few days before 6 months, it's still considered to be an effective dose. Okay. HPV vaccine given IM, 1 to 1.5 inch, 22 to 25 gauge needle, upper arm, deltoid muscle, all of the standard recommendations for vaccine administration. One of the things we want to really hit hard in this presentation is we shouldn't make a difference in how we approach HPV vaccine from the other vaccines that we give adolescents. That's really an important thing. It seems like it often gets set off on the shelf. It's different. It's for the children that are going to be promiscuous and have sex with lots of people. Absolutely not. It should be given to all adolescents. Storage and handling, refrigerator, 2 centigrade to 8 degrees centigrade, 36 to 46 degrees Fahrenheit, and original packaging, lids left on the packages, a clearly labeled bin, don't freeze it. Really standard recommendations for vaccine storage. There on the right side, there's a suggestion of what you should put on a label on the bin that you have your HPV vaccine in. Again, recommended 11 to 12 years of age. Use for everyone 9 to 26 years of age. It's a catch-up vaccine between 13 and 26 years. And the FDA, again, approved last October administration up to 45 years of age. The next slide is fairly busy, and I don't expect you to read the whole thing. However, at the bottom is the reference to where this is on the CDC website, which the cdc.gov/HPV website has lots of information, and there are a number of slides here from it. But just how do you remember which kid to give what for? This is a nice flow chart as to how you can tell how to give it. So, reviewing it again, boys and girls can start HPV vaccine at the age of 9. Preteens should finish their HPV vaccine series before their 13th birthday. Why do we say before their 13th birthday? Well, there's some interesting statistics about age of sexual debut, I believe is the term now current, and very low percentage of 11-year-olds are sexually active, and it can get up to 40% by 14-year-olds. And one of these discussions I had, I heard someone mention waiting until you need the HPV vaccine to get it is like jumping out of an airplane and asking someone to toss a parachute after you. Okay, so same recommendations for boys and girls, males and females. Catch up for everyone up to 26, and it is certainly an option that is allowable for those over 26 that have not had HPV vaccine that it would be indicated for. Okay, so let's go on, talk a little bit about safety. I hear lots of parents coming in saying, I've heard that HPV vaccine is dangerous and there are bad side effects from it. What do you know about it? I'm just really anxious about giving that to my child. And I hear more about that with the HPV vaccine, I think, than all the other vaccines put together. First thing is, how do we monitor for vaccine side effects and adverse events? Well, there's, first of all, the vaccine adverse event reporting system. It's a passive system where if there are any unexpected, untoward complications of giving any vaccine, fill out a form send it to the CDC. And that's a real good, sensitive way for them to look, is there something funny happening with this lot, this vaccine, this group of people? And that's something that is spontaneous. It's passive in terms of the FDA and CDC do not go out looking for them, but they are receiving it. Then there's the vaccine safety data link, that 8 large integrated healthcare systems link their databases together, and they do active surveillance and research on about 9.5 million people. That's 3% of the US population that we're looking for signal. Is there something going on here? Is something showing up with increased frequency? Similarly, there's the CDC and 7 academic centers that do the Clinical Immunization Safety Assessment Project. And that's a smaller number, a bit more intense, with people that are involved in vaccine research, vaccine safety, systems follow-up. And then there's another system that the FDA and 6 partner organizations have. If you look at that, 170 million people. That is an incredible number. That's over half the US population. Their medical records are being monitored for signals that would prompt further looking into this. So there are 4 levels of monitoring of immunization reactions, side effects, etc. Now, we have over 10 years of safety data on HPV vaccine after its introduction, and it's just resoundingly, the HPV vaccine is safe. Reactions, all vaccines can cause reactions. The HPV vaccine, I'm told, can hurt more than many of the others at the time of administration. Later, a few hours later, you can get pain, redness, swelling in the arm where the shot was given, fever, headaches. Those are not uncommon, and those are not specific necessarily to HPV vaccine, but are just the immune system responding to introduction of an antigen. Now, if there's been a previous allergic reaction, anaphylaxis, urticaria, severe reactions, probably not a good idea to give future doses of that. We started a few years ago, 10 to 15 years ago, giving a lot more immunizations to adolescents, and I've been amazed how many fainting episodes, syncopal episodes we see with adolescents. One thing that I noted in the office is the number of adolescents coming in the late morning that have had absolutely nothing to eat or drink that day, get a shot, jump up, start running out, and collapse and fall. And I have seen some significant injuries from the unprotected fall from syncope. I had one child that had a concussion and a broken jaw when he fell after, and that was a measles, mumps, German measles vaccine. Another child, I had to suture his head up after he hit the door casing. So it can happen. It's not specific to the MMR vaccine, but that's why, guess what? Recommend that they stay sitting down or lying down for at least 15 minutes. And often the staff will say, hey, here's a bottle of water. Have a drink before you get your shot. Get yourself hydrated and help prevent that. So it's also not uncommon with a fainting episode with syncope to have some jerking of the arms and legs. It's not truly a seizure, but it's from decreased oxygen to the brain that led to the syncope, and it doesn't have to be further evaluated. Okay, so again, a review of the ways that we're monitoring for HPV vaccine side effects, adverse reactions, etc. And it really is an intense observation. And there have been vaccines that have been pulled from the market from a couple dozen reactions that happen. So the take-home message for parents, HPV vaccine is safe. It has a good safety profile. There's a lot of monitoring going on, looking for the safety of the HPV vaccine, along with all of the other vaccines. And we can be very comfortable that this vaccine is safe. Now, looking at the impact of the HPV vaccine, we look at early outcomes, and we can do that within a few years. Middle outcomes, a few years to a few decades, and late outcomes that are decades. And obviously the big thing we're trying to prevent cancer, that takes decades to be able to show a big difference because it takes a long time with a chronic HPV infection to develop cancer. However, we can also look for CIN and precancerous lesions, and that takes a shorter time, a few years. And the early outcomes, just looking at HPV prevalence in testing, looking at genital warts, and seeing how that has been going on. So there are research studies going on around the world looking at these various things, and we reported early and mid outcomes in a number of countries. We've noticed in the US less infection with HPV vaccines that are contained, with HPV infections from the types that are contained in the vaccine, fewer genital warts, and less frequent cervical precancerous. So here from a national study on health, they looked at what's happened with HPV vaccines in people in various age groups. So the gray bars are 2003 to 2006, before HPV vaccine was introduced, and then 2007 to 2010, shortly after HPV vaccine. And an amazing 56% decrease in the 14 to 19-year-olds. A bit of an increase in the older people. And the oldest group, the 30 to 34-year-olds that they studied, a slight but not significant decrease. Why was it just in the 14 to 19-year-olds? They're the ones that got it. Now, following up in 2011 to 2014, so another 5 years, you'll notice down to a 71% decrease in HPV infections from the types within the vaccine in the 14 to 19-year-olds. But wow, look at the 20 to 24-year-olds. That was down 61%. Those were and it was primarily girls that got the vaccine early on. They've now aged into the 20 to 24-year-olds, and it's still a significant effect in the 25 to 29-year-olds. There's some herd immunity evidently going on here also, and even some, maybe not very significant statistically, decrease in the older group, the 30 to 34-year-olds. This is from Australia, looking at men and women, males and females, diagnosed as having genital warts at their visit to the doctor. And the different lines are the ages. The green line are the under 21. The brown line is 21 to 30, and the green line is over 30. And you'll notice very little change in the olders, although in men it did go down some, but very significant reduction and probabilities of less than 0.001 for the two younger age groups. So a dramatic decline in genital warts among both men and women in Australia that got in the population that was getting the HPV vaccines. So looking at 20 studies from 9 high-income countries, in countries that had more than 50% coverage among 13 to 19-year-olds, there was at least 68% reduction in the oncogenic 16-18 strains. There's evidence of herd effects, that people that had not gotten the HPV vaccine were less likely to get 16 and 18 type infections because of the number of people that had been immunized. And there may be some other strains that are being protected, some cross reactivity and cross protection. Studies suggest that the vaccine protection is long lasting. Going out 10 plus years, there's no decline in antibody levels, and that's something that we continue to monitor. So, HPV vaccination, safe, effective, provides lasting protection. And that's something we have to just keep hammering home to people, that there is lots and lots of scientific data, and there is very little, really no credible evidence against those statements. So, how do you talk to people about HPV vaccine? That's tough, and I get really frustrated talking with parents. I remember one family that mom looked at me and says, we had a discussion with our kids and they won't be needing the HPV vaccine. I tried to be nice and say, oh, are they going to be living as hermits by themselves on an island? That's about the only way I know of to prevent it. But how do you talk about it with parents? This is a slide showing adolescent immunization coverage from 2006 to 2017. Along with the introduction of HPV vaccine, we've had the introduction of tetanus, diphtheria, whooping cough, TDAP vaccine, and meningococcal vaccine, all routinely recommended for adolescents. And there was a lot of concern as we started doing this that adolescents just aren't coming in to get their routine preventive health care and immunizations. We're just not going to be able to do it. Well, if you'll look, in 2006, 10% of adolescents were immunized against meningococcal vaccine and Tdap vaccine. But look at how those numbers went up over the next 7 years. So for Tdap vaccine, we're getting up almost 90% protection, and for meningococcal at 80%. So we are getting the kids in, they are getting immunized. Unfortunately, HPV stands way below, and that's a tough one. The brown line here is at least one HPV vaccine, not the full series. And that's what the yellow line and then the teal line is getting the full series of vaccines. And it's a little bit of a blurb here because of the change from 3 doses to 2 doses. Yes, we're doing better. We're up almost to 60% for one and almost to 50% for full immunization. So we're lagging way behind in getting the HPV vaccine for the adolescents. So we did an estimate as to how likely is it that we could get the kids immunized. How often were they in at a time when it was possible to give the HPV vaccine and it wasn't given? Well, 47% are immunized, but 91% had visits where they could have been immunized and they weren't immunized. So that's a real challenge. And this is looking at girls that were born in 2000. Could they have been immunized is what we're looking at that. So when you talk to parents and ask them, why is my girl not immunized? Well, the most common reason cited was lack of knowledge, then not needed or necessary, safety concerns, concerns for side effects, not recommended is way up there, and not sexually active. Okay, again, I will refer back to my jumping out of the airplane and asking for them to toss a parachute to you. Significant number of teens are infected with HPV even on their first experience with sexual contact. It's highly contagious, has a high incidence, so they need the vaccine before their sexual debut. This was something that when I was reviewing the slides that really hit me. This is looking at parents. What value do you place on the adolescent vaccines? Each vaccine and all of the vaccines in general. And it really hit me how influenza and HPV, 9.3 on a 0 to 10 scale of parents said that it was a valuable vaccine. And then you ask clinicians, how do you think parents feel about these vaccines? Well, okay, pretty close to the same, although a little bit under the parents' estimation of value for meningitis, hepatitis, pertussis, whooping cough. But wow, look at influenza and HPV. Clinicians underestimated the value that parents place on these vaccines, dramatically less. Parents are much more receptive than we think to getting the HPV vaccine. So the perceived and real concern of parents influences how clinicians recommend the HPV vaccine. Sometimes it's a hurdle for me even to bring it up because I get so tired of parents saying, oh, we don't need it. There are too many bad side effects. It might make the kids think about having sex, all of those things. We really need to routinely recommend it as a strong recommendation, as something that's safe, effective, and prevents cancer. So, an effective recommendation from you, the healthcare provider, is the main reason that parents decide to vaccinate. Multiple studies have shown that. In focus group, mothers state they trust their clinician and they would get the vaccine for their child as long as they received a recommendation from the clinician. And I find that to be a heartwarming thing. If we tell the parents that we think it's valuable, greatly increases the odds of them being receptive. What a novel idea. So what is an effective recommendation for HPV vaccination? The same way, the same day as all the other vaccines. Okay, the same way, recommend HPV vaccination the same way you recommend Tdap and meningococcal vaccines that are on the schedule at the same time for the same group of people. The same day. Recommend it today. When you have an 11-year-old in, don't say, well, before she becomes sexually active, we need to give her the HPV vaccine. No, it doesn't work because, first of all, I'm convinced that there are many parents that believe their daughter is going to be 35 years old, single, virgin, with 3 kids. It doesn't add up. People get funny when they start thinking about that with their kids. Just tell them today your kid needs 3 vaccines to protect against meningitis, HPV cancers, and pertussis. Bundle them up, say we recommend all of them. And so, talking about a scripting for it. Now that Sophia's 11, she's due for 3 vaccines. These will help protect her from the infections that can cause meningitis, HPV cancers, and pertussis. We'd like to give these shots today. Okay? Now, they might ask some questions and say, all right, the first vaccine, the meningococcus, is to prevent an infection that can cause meningitis. It's rare, but potentially rapidly deadly. The second, to prevent a very common infection, HPV, that can cause several types of cancer. The third is a tetanus and pertussis booster, so she doesn't get tetanus or whooping cough. We'll give these shots at the end of the visit. Any questions? Okay. Many, and I would actually say from experience, most parents will accept this bundled recommendation. Some parents may be interested in vaccinating, but they still have some questions. Okay, think of a question as they need additional reassurance from you, the healthcare professional, that they trust with their child's healthcare as to what to do. And ask parents, what's your main concern about this? Make sure you're answering the right question. That's really, and take time to listen to parents' questions because that saves you time and you can give an effective response to it. Don't just fire the shotgun and try and hit all targets. Find out what the parents are most concerned about. Okay, usually they'll ask, why does my child need an HPV vaccine? Well, it's important because it prevents cancer. That's why I'm recommending that your child start the HPV vaccine series today. They might say, what cancers are caused by HPV infection? Okay, persistent infection with HPV can cause cancer of the cervix, vagina, and vulva in women, cancer of the penis in male, cancers of the anus and the throat in both. We can help prevent infection with the HPV types that cause these cancers by starting the series today. Is my child really at risk for HPV? It's a common virus, infects both males and females. We can help protect your child from the cancers and diseases caused by the virus by starting HPV vaccination today. You'll notice that in these scenarios, these scripts, it keeps hitting on protect. And that's something that's been found with studies to be very effective talking to parents. We are protecting your child. Why at 11, 12 years old? Great illustration here. When should you put the bike helmet on? Before they get on the bike? When they're riding their bike in the street? When they see the car heading directly at them? After the car hits them? This is kind of a duh. Or seatbelts. When do you put the seatbelt on? Right, after a near accident. Sure, right. Just when you leave the driveway. No, these are things that need to be done in advance of any need for it. As with all vaccine preventable diseases, we want to protect your child early. If we start now, it's one less thing for you to worry about. And hey, as a benefit, if you start before you're 15, you only need 2 shots instead of 3. So we can give the first shot today, come back 6 to 12 months for the second shot. I found that for that, most of the parents are amenable to say, and at next year's checkup, we can give the second shot. Okay? I hear parents say, I'm worried that giving this HPV vaccine is a green light to have sex. Oh, I just can't say it. Well, numerous studies have been done. HPV vaccine does not make kids more likely to be sexually active or start having sex at a younger age. I have never heard of HPV fear inhibiting what happens in the backseat, okay? Starting the vaccine series today can give your child the best possible protection for the future. Again, protection, protection, protection. Okay, how long can we wait and still just give 2 doses? Well, okay, if it started before the 15th birthday, but hey, guess what? By 14 years of age, the risk of getting HPV starts rapidly rising. So older teens, harder to get in, they have busier schedules, it's difficult to get them in. We're here today. They respond better at an earlier age with more antibody protection. Those are reasons why we recommend giving it today. Well, I'm concerned about the safety. I read things online that say the HPV vaccine isn't safe. Do you really know if it's safe? I like the suggested scripting here. It sounds like you want what's best for your child. And I've never gotten anywhere accusing parents of not caring for their children. It just doesn't work. Say, hey, you've got concerns? Is that the problem? Well, we're on the same page here. We want your child to do well. We want your child to be protected. What are the concerns? Because I've researched HPV vaccines about the safety of them. Can I share with you what I've learned? Okay, whoops, I already went through that slide. I know there are stories in both media and online about vaccines. I want you to know that HPV vaccine has been carefully studied many years by medical and scientific experts. I mean, the first women that received in clinical trials HPV vaccine were looking at 20-year follow-up, and they're still following them. So based on all these studies, I believe HPV vaccine is very safe. Yes, it is possible to have a severe adverse reaction to it, just like it's possible to be in a car accident and have serious injuries or death on the way to the office or on the way home. There can be side effects. You can get pain, swelling, redness where it's given, maybe a headache. But we have not found any serious side effects associated with HPV vaccine. I think that's a real good approach. Can HPV vaccine cause future fertility problems? Okay, there's no data. We haven't found anything about that. But guess what? Women who develop cervical cancer or precancerous lesions can require treatment that limits their ability to have children. Starting the HPV vaccine series today could prevent that from happening and protect your daughter's ability to bear children. Well, how do you know if the vaccine works, a parent might ask? Well, we've got studies ongoing showing that HPV vaccine works very well. HPV infections, genital warts, cervical precancers in young people have all decreased. And yeah, if you really want to snow them, give those by over 50%, up to 70% in the years since this vaccine's been available. Starting the vaccine series today will help ensure that your child gets the best protection possible. Because HPV vaccine was first just for girls, I still see parents that are asking, well, why do boys need to get it? He's not going to get cancer of the cervix. Well, HPV infection can cause cancers of the penis, anus, and throat in men. HPV infection can also cause genital warts. And I was interested in seeing that previous slide showing that men get almost the same rate of cancer in the nasopharynx, oropharynx, as women get cancer of the cervix. It's a very real risk for guys. So getting HPV vaccine today for your son can help prevent the infection that can lead to these diseases. Well, we only want vaccines that are needed for school. Well, okay, I hear that every now and then. It's important to point out, school entry requirements do not always reflect the current recommendations to keep your child healthy. There are several vaccines that we strongly recommend that are not required for school entry. And that it's more, the school entry requirements are kind of a minimum of what's necessary for public health. And HPV vaccine is not required, but it is required to give your child the best chance at staying healthy and protected. Would you give HPV vaccine to your kids? Man, I sure hope all of us can answer this. Yes, I have given HPV vaccine to my child. Well, I'm old enough, my kids were out of the age range when it came out, so I didn't give it to my kids, but I certainly have strongly encouraged it for my grandkids that are into the adolescence. They've gotten it and continue to recommend it. So the American Academy of Pediatrics, the American Academy of Family Physicians, the National Institute of Health Cancer Centers, the CDC, all agree that HPV vaccine is very important for your child. Now, every now and then we get this question. I heard that there's a new updated HPV vaccine that's more effective. My child already had his HPV vaccine, but I think it was only the first generation 4 types. Should he get the 9 type? Well, currently there is no recommendation for additional vaccination for someone who's already completed an HPV vaccine series. All HPV vaccines protect against the infections that cause most of the cancers. 16 and the 18 are the 2 that cause the most likelihood of cancer, that cause the most damage, and those are in all 3 of the HPV vaccines that have been used. Well, when do we need to come back? Well, since your child is younger than 15, we need to give a second shot 6 months to a year. So make an appointment, come on in for a checkup or to get the vaccine. We'd like to do that and get her protected. Or if your child is already 15, we'll need a second shot in 1 to 2 months. The third shot is due 6 months from today. So make those appointments. Let's get that going. So there's some kids that will need a third shot and they're less than 15. Why would that be? Well, the recommendation is to give 2 shots 6 to 12 months apart. Minimum would be within 5 months, but maybe you still got one and then the second one 1 to 2 months later, as in the old recommendation. So that's not 5 months, so we'll need to get another one, get a third shot for your child. Will the child be protected with just 2 shots? Yes, it shows that that works as well. Giving 2 shots to the younger kids, it may even be working better than giving 3 shots to the older kids. Again, the younger children have more robust immune response to the HPV vaccine. So if after you've gone through these things with the parents, answered their questions, if they don't say yes today, what should you do? Well, first thing is make sure you understand, and it's a good idea to document their concerns, make sure you understand why they're not interested. Emphasize that it's the parent's decision. Acknowledge that there may be some risks. There are conflicts in information sources. I like to tell people that the only thing necessary to have an authoritative website is a good web designer. You don't have to have facts. Applaud them. Point out you're looking for what's best for your kid. And that's an important thing to recognize. We're on the same page in terms of wanting what's best. And you're concerned for their child's health, not just the safety of all children, not public health. Allow time to discuss the pros and cons. Be willing to discuss their ideas. Offer some written resources for parents or some trusted online resources. And think about some of the things that we've gone over here about how can you present it in a way that will help to make parents more comfortable with administering the vaccine. Remember that their declination is not final. We can talk about it again later. End the conversation with at least one action you both agree on. Emphasize again, we are on the same team. It is appropriate to just mention waiting to vaccinate is risky. Many pediatricians will ask parents to sign a declination form saying that they do not wish to have a vaccine. Also encourage you to have systems to make sure all of your patients are protected. Make sure that you immunize at every opportunity, not just when they're in for a checkup or asking for an immunization. Use standing orders. Encourage the staff to each visit look at the immunization status and consider them as candidates for getting their immunization status updated. We've got a variety of tools and it's hard to get them to work well, but it's worth the effort. Your EMR can do a study, can give flags, hey, this kid needs this vaccine. The immunization systems in Maine, our impact system, the state immunization registry can review and print out lists of kids that are due for vaccines and doing reminders and recalls. Years ago when I was working part-time for Cigna, I wrote an article for the Cigna provider letter, and the article that I wrote, I titled, "If Vets Can Do It, Why Can't We?" The veterinarians are much more effective at telling us that our dog or our cat needs shots than we are at telling parents that their children are. And that's something that I'm embarrassed to say. Remember that HPV vaccine is cancer prevention. Fringe benefit, you get protection from genital warts, but cancer prevention is the point behind it. Make sure that all of the staff in the office are acquainted with HPV and understand why we feel that is important. You'll notice that there are a number of resources here, again, from the cdc.gov/HPV website. A lot of good stuff for parents, a lot of good stuff for healthcare providers. There are multiple education materials available free through the CDC website. And know what your coverage rates are. Track and see, how are we doing? Are we making progress? Are we getting more kids in? Rates for individual clinicians are better than rates for the clinic because you can see who do we need to have a chat with. Okay, you can get data from your EHR, you can get information from the immunization registry, all that can help to take care of this. So, HPV vaccination is cancer prevention. You, on the front lines, interfacing with parents and adolescents, young adults, are the key to getting this done. Okay, great hashtag there from the American Cancer Society. We can stop HPV. This is preventable. Okay, I haven't seen a kid with measles since 1979. I can remember seeing a kid with polio when I was a toddler in the mid-50s. We wiped these things out. I've never given a smallpox vaccination. I've been a physician for 43 years. You can do it. We can wipe it out, but it takes a lot of work. If you'd like a copy of this slide set, it's from the American Cancer Society. You can email me. There's my email address at the office, and be glad to send you a copy of this slide set. It's only very loosely altered from what came from the American Cancer Society. And here's a list of references. I'm not going to ask you to write them down. One thing I would encourage you to write down: websites that have good, accurate information about immunizations in general, HPV vaccine specifically. I've already mentioned the cdc.gov. Another one is the American Cancer Society website, cancer.org. The Children's Hospital of Philadelphia, CHOPS, has a website, and the Vaccine Education Center that has all kinds of great information, again, both for professionals and for lay people. And the Immunization Action Coalition is the fourth one that I'd like to bring up as a trusted website that has accurate, believable, correct information. So I made it through the 106 slides, although that counts the ones that I didn't bring up. Wondering if we have any questions. I don't see any here on the Q&A tab on my screen. Wondering if anyone wants to send in a question. We can try and do this and see if anyone has anything they'd like to ask, and see if we can be of assistance for you on. Any questions?
You'll want to type any questions you have into the Q&A section there. I'll give folks a minute to type in. And for those in the meantime that are wondering about continuing education credit, you'll receive a follow-up email with how to access that credit. We have a question there.
Oh, there's a question there. Oh, okay. Natalie was wondering what my email address was. It's llosey@midcoasthealth.com. Okay. I would say your name, Aglaya. Is it known if there's a greater risk according to gender? Risk for cancer or risk from the vaccine? I'm unaware of any studies showing a greater risk that's gender-based for the vaccine. obviously men can't get parts that only women have, and women can't get cancer in parts that only men have, but surprisingly close incidence levels overall for HPV cancers. As I mentioned, cancer of the throat, oropharyngeal, nasopharyngeal carcinomas are more common in men than they are in women, and roughly the same order of magnitude prevalence as it is for cancer of the cervix in women. So I think it's fair to say that HPV is equal opportunity. Okay. I did not mention pregnancy, Mariah, and it is not recommended during pregnancy. One of the registries that in the monitoring group that I mentioned was they are monitoring when the vaccine is given during pregnancy, presumably inadvertently, to know if there are any adverse outcomes for the baby. We certainly have seen a change in the attitude towards immunizations during pregnancy. I can remember 10 years ago being told that immunizations in pregnancy was the third rail of immunization science, that nobody dared touch it. But now we're strongly recommending that influenza vaccine and Tdap vaccine be given during pregnancy to help protect the mother and to give the baby passive antibodies. So the answer is we don't know, and it's not recommended. Oh, an anonymous attendee. Can teens agree to this vaccine without parental consent since it has to do with sexual activity? I have seen some discussion about making that a possibility, but I would be loath to give it. I think it would be opening up too big a can of worms. But I would certainly encourage the teens to talk with their parents, and I'm glad to talk with the parents, but I would be reluctant and would refuse to give it to a 11, 12, 13-year-old that wanted it if their parents did not agree to it. That said, the law in Maine is that pre-18-year-olds can obtain health care without parental consent for sexually transmitted diseases, contraception, pregnancy and its complications, mental health, and substance abuse. There is no age in the Maine state law for that. I'm not acquainted with the specifics of other states, and I don't know if we have any attendees from other states, but I would not recommend giving it unless the parents have agreed to have it. Okay, that's all of the questions that we have so far. Any other questions? I hope I didn't talk too rapidly for you. We had a lot of slides, a lot of stuff to go through, and I'm glad that we got through it in the 50 minutes that I had allotted for it, and have a few minutes here for questions and answers. Any other questions? Anything else?
Not looking like it. So what we'll do is we'll send a follow-up email to folks that has a link to an evaluation survey and information on how to access continuing education. If you have any additional questions that were not answered today, you're welcome to reply to that email with those questions, and we can work on getting you those answers.
All right. Well, thank you all for joining us. I certainly prefer seeing the audiences, the whites of their eyes as the way we do it, but boy, it sure is convenient to do this online, isn't it? So hope everyone has a good afternoon, and hey, we're doing this to stamp out cancer. Keep that in mind, and that will really help in your approach. Okay? Thank you very much, and have a good afternoon.